So today we're talking about why we went through all of the trouble to get a controlled substance license, and and more specifically the value of carrying that that designation, which enables us also to be designated as an opioid medication assisted treatment center. Um, and so to get started, I guess, what is a controlled substance license?
Yeah, so a controlled substance license is a specific license to the state of Colorado that allows us to hold, possess, and distribute as needed certain controlled medications for the treatment of an opiate use disorder. So specifically for us, that means buprenorphine and buprenorphine-based medications such as Suboxone that we use here generally on a daily basis for a lot of our patients to treat their withdrawal symptoms, to treat their craving symptoms, as well as to provide harm reduction benefits to them, their overall well being.
Fantastic.
Yeah.
Yeah. Um, so what makes us in the OMAT side of it, the opioid medication assisted treatment side of it, comes from that controlled substance license, in that it enables us to operate on the one hand under that controlled substance license, like a clinic, right? Like the same way that a methadone clinic carries methadone and manages the medications of and the distribution of that methadone to their patients. We are able to
Yeah.
carry and manage the buprenorphine and naltrexone based medications to our patients. And then simultaneously, because that is only half of our designation, the other side being a substance use disorder
Right.
license, we're able to operate as an outpatient addiction treatment center. So we hold these two simultaneously, and in so doing, are able to integrate the services in a pretty unique way. So
Absolutely. I think it gives
yeah,
us the ability to have the best of both worlds.
yeah,
That allows us to have the benefits of what a methadone clinic, even though we don't prescribe methadone, but those perks of being able to directly distribute medications to the patients, we can do that. And we also have the perks of our outpatient addiction treatment license to do things like group therapy, individual counseling, family counseling. We can kind of, our program's able to integrate the best of both worlds.
yeah. So what would what are the real advantages there? How does that benefit the opiate addicted individual that comes to us in a way that, say, the methadone clinic down the road might not be able to?
Yeah, that's a great question. I think of our ability to manage medications in such a quality way. Those early days of opiate recovery are difficult. Cravings are high, risk factors are really high, and medication compliance is so important then to make sure that someone's taking their medication as prescribed when they're supposed to take it, that those medications aren't being diverted, that they're not abusing other drugs. So the fact that our patients, when needed, not always, but that they can come in here every day, directly get their medications, and have that accountability and structure around their medication compliance is really helpful. And then also, it gives us multiple touch points with patients and allows us to really integrate their medical care into the clinical care, which is the vital recovery piece is our clinical program.
So it really sounds like there is an ever increasing progress that a patient can experience, that they aren't that the quality of life benefit isn't strictly the switch from an opiate to a MAD or an opioid replacement MAD.
Right.
It's that you essentially from day one they are, they're being assessed comprehensively, and then they're being treated so that while they're doing the med management piece, even as from day one, the daily dosing, they're not just coming in for
Sure.
a dose, right? They're
Right.
also going to have some form of clinical intervention with a provider.
Absolutely. All of our patients will always be provided with structured clinical and counseling services. That is the core of our program, as much as we talk about the medications, because I do think that's such a life saving and life changing part of our program. It is only one piece, and it is a smaller piece than the structured clinical counseling that they receive here. So,
Wow.
I just think again, a fact that we're very proud of is, as far as we know and as we've been informed by the state, we're actually the only program in Colorado to carry both of these licenses, the outpatient addiction license as well as the controlled substance license. And I think it puts us in a unique place to really treat and care for our patients in a special way.
Wow. Yeah. That's really great stuff. Um, so interesting. Yeah, I guess that's really all we have to talk about today.
For this week,
Yeah.
well, we'll be back.
Yes, we will. Every other week, we'll be bringing you more of these wonderful brief conversations, and we will be bringing in guests from both the MAT side of things as well as more of the addiction side of things to really enhance this conversation and bring beneficial and educational content um, to the World Wide Web.
Tune in next time. Thanks for joining us.
Thanks so much.